Welcome back to Studio 701.
So there are times you've eaten garlic or onions and you may want to, cover your mouth when you're talking with someone else. And then there's something that's maybe a little more serious.
Well, Mikaila Davidson is a dental hygienist with Polish Dental. Mikaila, thank you so much for being here today.
Yeah.
You have a big, somewhat humbling subject to talk about, right?
I do. We're talking all about bad breath today.
Okay, so it has a fancy name.
Halitosis.
Halitosis.
Yes.
So what is that exactly?
I mean, it's basically just the medical term for bad breath.
Okay.
Yep.
And then, how do you get rid of it? Versus like the eating the onions and garlic and, oh, I need to brush my teeth afterward kind of thing.
Right. So, of course, there's bad breath from foods that we eat, stronger things such as onions, garlic, coffee. But then there's other things, too, that could be contributing to that you might not even think about.
So is halitosis is it a bacteria problem, or is it actually something going wrong in the body?
Lots of different things, actually. It can be both. The bacteria in your mouth that we feel in the morning when we wake up, kind of that gunky feeling, is full of bacteria that lives all around your tongue, your teeth, your gum tissue. And so if you're not brushing and flossing to get rid of that, definitely a contributing factor to bad breath. It's kind of a gross analogy, but one time somebody explained it to me as like opening up a garbage lid, how all of that just kind of is stinky and smelly, and when you get all of that out of there, it kind of can be the same. It's kind of gross.
It is a good visual to help you understand, but yeah,
is.
that is not appetizing.
No.
And we said this is a great topic right now ahead of Valentine's Day.
Yeah, we don't want to screw anything up.
Yeah,
for sure.
Fresh breath around our sweeties.
Yes.
But, I understand having dry mouth can maybe contribute to that.
Absolutely. So if you're someone that suffers from dry mouth, a lot of times that saliva helps us to get rid of the bacteria, keeps our mouth moist. And so if you don't have that, it basically just is an environment that's going to really make that bad breath worse. Sometimes bad breath can be caused from medications, smoking cigarettes, using alcohol, things like that will really dry your mouth out. And so if you're having dry mouth, you should really speak with your doctor or your dentist to kind of get to the root cause as to what could be causing it. If you are suffering from it, drinking a ton of water is one of the best things that you can do to help. And then just, of course, brushing, flossing, keeping everything really clean.
Okay, Mikaila, how do we know if we have dry mouth or if we're just thirsty in the day? Is there a difference?
Well, yes. Dry mouth a lot of times is a little bit more than just being thirsty. Like your tongue feels dry, like you'll hear cotton mouth sometimes is how people will describe it. It's probably one step more than just feeling the need to drink water.
Okay, and what are some treatments? Is there anything medically we can do for dry mouth?
Well, we do have a couple different options. At our dental office, it's called Xylamelts. We use it for patients a lot. It's like a little tablet that you can put up along kind of the cheek side of your gum tissue.
Okay.
You can sleep in them. It helps to stimulate salivary flow. Sometimes it's different medication interactions, and so speaking with your doctor to maybe try different brands or there's lots of different contributing factors, just getting to the bottom of that.
I'm excited because you brought some things.
I did.
What did you bring today?
Yep, so one thing that we're finding, if you're using a mouthwash, say like Scope, it's gonna mask the bad breath, but it's not gonna completely get rid of it. Some people are deficient in zinc, and so using a mouthwash with zinc in it will actually help to completely get rid of the bad breath. And so the one that I brought is the one that we have in our office. It's called OxyFresh. You rinse with it, you spit it, obviously in the sink after about 30 seconds, but that has zinc in it, so it will actually kill the bad breath so that a half an hour later it's not coming back. Another thing, like we kind of touched on, is that bacteria is all around your mouth. So brushing your teeth really well, flossing, of course, but also brushing your tongue is huge. You don't need a tongue scraper. I brought one. You can use your toothbrush. Some toothbrushes the back will have like some little grippers on it, or you can use this, and basically you just scrape your tongue with it. It helps to get rid of a lot of the bacteria. If you've ever had coffee in the morning and stuck your tongue out, it looks more like yellowish. That is just full of that coffee odor. So using this will help get rid of that and improve the smell of your breath.
Okay, that might be a great tip for us here on the morning show. Go through a lot of coffee. Okay, great advice. Thank you so much, Mikaila.
Thanks for having me.
And Polish Dental is located in Bismarck and accepting new patients. They utilize state-of-the-art technology with dental care and create personalized treatment plans for their patients' individual needs. To schedule an appointment, make sure you call them at 701-222-4746. That is 222-GRIN.